Thank you. Okay, that was fast. So, first of all, I'd like to thank the conference organizers for giving us this opportunity and also inviting us from, as a technology provider to share our perspectives on how the industry is evolving and how we see digital transformation in healthcare through our lens. And I'm quite delighted to say that several of the messages that have been discussed and communicated through the sessions in the morning and as well as Dr. Roka's previous one are definitely in line with what I will also be talking about. And so I think we are all on the same page is what I would like to say. So for the esteemed audience that is not aware of SAP, so we are one of the largest software provider companies, especially for business software, and we are 90,000 employees strong, and we work with approximately 355,000 customers across 25 industries, anywhere from retail to mining, oil and gas, and of course healthcare and life sciences, and we have a footprint in life sciences and healthcare as well. So we work with approximately 8,000 customers in healthcare, and the software services that we offer can range anywhere from traditional ERP all the way to up to our healthcare specific industry solutions, which is on patient accounting and patient billing, and we have integrated suite of clinical information systems along with our partner Cerner. So fair to say that we have a really global perspective on how the industry is evolved and how digital transformations taken place over the last 46 years that we've been around. And very interesting number that we like to share is that more than 77% of the world's transaction revenue touches an SAP system. Pretty much the world's revenue goes through our systems. And our mission is to help companies and enterprises, whether it's small or large enterprises, run better and to also improve people's lives. And this is extremely important because it links back to how we see healthcare and how we can truly impact healthcare at the scale that which we think is relevant and improve patient outcomes. So I would like to quickly walk the audience through some of the challenges that we see are facing the healthcare system. And some of this has already been discussed, so I won't go into too much detail, but it's more so to set the context of how we see it and also talk about what the opportunity is for healthcare and move on to some examples that with customers that we are working with, and then we've seen true transformation and how we see the future going forward. So just a few numbers to highlight the burden of disease that is inflicting the healthcare system, and also the fact that majority of these diseases, and at least almost 56.4 million global deaths. Of that, 70% of that was due to non-communicable diseases, and 80% of that was because of cardiovascular diseases. And even in the case of infectious disease and like tuberculosis or influenza, the case fatality rate can vary quite drastically from 5 to 20%. And all of this really highlights the urgent need to focus on either prevention and wellness, and as well as early detection and diagnosis. And we've had enough of research shared as well on this. Now, moving on to other global trends that are impacting the healthcare system. One, we're seeing an increasing demand on the healthcare system, right? Population is living longer, and there's this burden of chronic diseases, conditions, and then we're also seeing unbelievable escalating costs. So we've got the global healthcare spending is projected to be approximately $8.7 trillion by 2020. And we had, I think, Dr. Vandenberg mentioned some numbers for Europe as well. So it's astronomical numbers in terms of the amount that's being spent on healthcare, and a lot of it is simply just wasteful. Because of lack of early detection and prevention and wellness, and you simply stretch the problem here. And also the cost of drug development has skyrocketed. So one number according to Tufts pegs it at $2.5 billion now to get one drug out and approved in the market. So suffice to say that, the healthcare system is facing a lot of pressure. So that's on one hand. On the other hand, we're seeing this, technology trend and also this, big data explosion. So you are more than aware of how the cost of sequencing has come down to like under $1,000. And yes, even though the adoption is not as much as we would have hoped for, spurring the personalized medicine, precision medicine movement. However, what that leads you to is a lot of data, right? Terabytes of data. And then the minute you start adding other sources of information, there are approximately 365,000 health apps, just health apps. Right? And then you start adding streaming data coming from trackers, and now you're getting into petabytes, and then you're getting into exabytes, and then if you start looking at all the information in internet traffic and speech, text information that is out there, all the media, then you're getting into zettabytes. That's like 1 followed by 21 zeros. It's astronomical. It's that huge. And the challenge there is you have a lot of data, right? In this case, but how do you make sense of all of this? How do you separate the signal from the noise and make smart data out of big data? And then on the other side, there's this huge movement on the patient side, right? So we're focusing on patient centricity. It's become like the buzzword, at least the pharmaceutical industry has been talking about it for a while now. Again, in pockets, and of course, healthcare systems you would think are intrinsically patient-centric, but we know that there are discrepancies there when we're looking at sick care versus truly health care. And then you have, health information seeking behavior, you've got digital tools, you've got consumerism in healthcare. So you've got, several of these factors that are impacting the healthcare system. And ultimately, the economics reward treatment, right? So there's underinvestment in wellness. You're focusing the investment on new therapies and drugs and medical devices, and there is a need for it, surely. But it also means that there's less investments in other areas. And then the innovation focus is more so on the hardware side. You've seen some extraordinary advances in diagnostic devices and all that. But the software has to keep up as well. So what we observe is also that in several markets, there's immature IT and infrastructure to support these advancements as well. And the biggest challenge of all is, of course, disconnected systems and the regulations behind it not being able to communicate with each other. So you have islands of data silos, and Dr. Roka mentioned about it as well. So you have to look at how could we improve collaboration. And ultimately, healthcare is probably is a laggard when it comes to digitization. So it's not a technology problem at the end of it. So technology is out there, it's being adopted, but healthcare has its unique set of challenges, right? In terms of just looking at the risk-averse nature in certain markets versus the US, which is a bit more open to change. And then if you look at Europe with data privacy laws. So what role does technology play in this? And as a technology provider in SAP, how can we influence our customers in a way that makes sense for them, and also listen to them so that we are building the right things for them? So if we had to look at what is the opportunity, right? So traditionally you look at hospitals or healthcare providers, and then you're focusing on how do you make them run, right? So how do you stir your company? How do you make them financially viable? So this is like one of the biggest needs. How do I stay afloat? Our healthcare leaders tell us. So I have to make sure I have enough money in the system in order to then invest in systems of differentiation, right? So how do I differentiate myself? How do I remain innovative? How do I provide the right kind of information and innovative applications back to my customers? And all of this using data as its foundation. But ultimately, again, this is silos within the healthcare organization, right? And we believe at SAP that it cannot be that one side does not talk to the other and you do not put patients at the heart of it. So it has to be an end-to-end experience. So the way we view it is all systems need to be able to communicate with each other, and it has to be patient-centric. So you have to have this one entity or this like a data type that is patient, that is common across the healthcare system as well as between healthcare providers. So ultimately, if you extrapolate this outside of just the hospital, you see a similar picture was presented before, and this is how we see it as well. It's connected health, and this indeed is the future of sustainable business innovations. And I will talk about some examples where SAP has been at the forefront of connecting different healthcare providers and enabling this connected health business model. So at either the provider side as well as between research and labs and medical devices. Now, we've spoken to a lot of healthcare leaders, right? So we have a footprint in approximately 8,000 healthcare customers and some of the leading health systems in the US as well as in Europe and several other markets. And listening to them, we've identified that there are, together with them, top 5 needs. These like basic customer needs. And I would like to say this is some form of a continuum roughly, that unless you fix one or two of these, the first 2 higher order needs, it's quite difficult for them to truly go and change the way they do business. Even adopt cloud computing technology and all of this is just a buzzword for them, right? Unless you fix some of their, use that to fix the problems that matter to them. So operational efficiency, like I mentioned before, are my services utilized properly? Are my resources utilized? Within the hospital in terms of operation theater or inpatient outpatient services or the nurses or the surgical equipment, and is that financially viable? Am I saving money, losing money? Patient outcomes, what's the clinical quality? And this appeals to chief medical officers, right? And then focusing on data-driven clinical innovation, something above and beyond, looking at using those data lakes that they have created then to generate further insights and get into clinical decision support and at the point of care and other innovative applications. Workforce empowerment, and then ultimately bringing all of this together, looking at the patient experience. Small things like the waiting time. Did I get a reminder, or are they measuring quality of life? Are they measuring how satisfied I am with the services that they offer? So ultimately, it's a sort of a composite of these 5 digital priorities. And what we believe is important is once you've identified the customer needs, you have to be able to have a mindset to tap into some of these digital transformation accelerators. I will not go into detail on the mobile and sensors and Internet of Things because we had Dr. Kirkham give several examples in the morning. But then these are, for us, as we see it, is simply different sources of data, different types of data. They're completely different structure, different formats. They're not harmonized. And ultimately, what is going to help connect all this disparate sources of data as we see it, like use APIs, these are application programming interfaces, and you also see that you need to use standards like FHIR, like fast health interoperability resources, in order to enable this communication. Now, it's going to be a very long process, but we've already seen quite a bit of momentum in the market, and several of the big players are trying to, do this. With Apple, with the, patient with the health record, they're using FHIR, and then we've got some of the other players in the market, and us included, that we're adopting FHIR as a standard and working with our partners like Cerner, it's an EHR company, to push for FHIR, to enable this data sharing and to create this connected health scenario that we are talking about. And also bundle some of the services that we offer with microservices, so that application developers can create those innovative applications, right? And fairly quickly. And ultimately, all of this offered in a cloud platform. And then once you have the data in there, I think someone in the audience spoke about harmonization of data and what sort of ontologies would you bring in. So if you manage to get the data out of different systems, I think the next problem that you see is simply how do you make sense of the data. And we see that only 20% of the data that's sitting in clinical information systems or other systems are structured. 80% is unstructured data, sitting in clinical documents, pathology reports, so you can do all the testing and screening, and ultimately it will make it into a clinical document. And that is a goldmine of information, data. And how do you tap value? So we've been using, in our platform, we've got like text analysis services and natural language processing services that's able to extract the relevant clinical entities. And we also use ontologies and different libraries and dictionaries, like, so we've got the ICD-9 and ICD-10, we've got SNOMED, we've got RX norm, and we use LOINC for all the lab values. So ultimately, we're able to extract the relevant entities and then convert unstructured information into structured information with the right polarity and the right context. And so you sort of got to train these services, and I think we offer it in English, German, and French, and we also partner with several other providers of NLP services. So if I had to like summarize this, you've got the data out now, and then you've got to extract value from it using perhaps text analysis. And then what we believe is important is to create this longitudinal patient view, like I said, that one patient entity, and bring all those different data types together to truly create that view of how the patient is evolving over time, and what are those different factors that interplay, and apply the corresponding machine learning models. And then the applications are extensive, as Dr. Kripa mentioned in the morning. But the core of the problem is simply getting the information together. That's the first part. And if you don't have the data, then machine learning is only as good as the quality of the data that you have, and to be able to train your model. So we at SAP are trying to focus on trying to bridge that gap with our digital platforms, getting the data in first place, from federated from different systems. So we're trying to close that gap. However, technology does not exist on its own, right? So if we had to look at it in two dimensions, technology is maturing at a completely different pace than what's happening in reality, which is looking at the business model of that. So we've got volume-based reimbursement, which is traditional fee-for-service scenario in healthcare. And we see that, it's sort of moving, the paradigm shift is moving towards value-based care, but it's taking a bit of time. And there are several disparities as well in terms of which markets are willing to adopt it. The US has certain policies in place in order to bring healthcare costs down and to improve patient outcomes. Nordics are also, quite a bit more advanced in that place. But unless you have, the policies in place in order to adopt the technology and also to move towards this, I think it's going to be a really long battle before we bring the healthcare costs and have real value patient outcomes, right? So we see that ultimately digital transformation and applying systems of intelligence could be a core accelerator towards moving from volume-based reimbursement to value-based care, because unless you can measure it, then you're truly not there, right? So that's how we see it. And to summarize this is our sort of vision for the intelligent enterprise and intelligent healthcare provider, which is again fairly in line with how Dr. Oka put it as learning health systems. And so I felt quite happy when he used that term as well, because it's pretty much the way we see it as well for the industry and across industries, that we've got like a core component, which is the digital platform, which helps you bring all the information together, and then you have this sort of feedback loop, and you have what the intelligent healthcare suite is simply application software, service applications, which are part of your business process. And then you embed the intelligence into it, which ultimately helps you address your needs of either operational efficiency and data-driven. So for us, it's not two silos again. It's not more. We don't want to complicate and add more software solutions into the mix, but it has to work together, and it has to feed back into the other. And so sort of summarizing the evolution on how we've seen, and we've been in the industry for like 46 years, of course. SAP started way earlier than I was even born. So suffice to say, I can definitely comment for the client server and internet onwards. But in terms of customer value generation, we are now heading into an era where all enterprises are demanding intelligent technologies. They're simply sitting on a wealth of data, and they want to make sense of it. They want to derive business value out of it. Whereas healthcare has to catch up. Healthcare is still I believe, to some extent struggling with the previous pillar, which is on the cloud, mobile, and big data digital transformation. So it's going to be a while before the industry catches up. And I'm just going to quickly give you 2 or 3 examples of how we have moved from data to insight to action, keeping the customer experience in mind. We worked with a leading cancer research center in Gustave Roussy in Paris, and we were able to ingest clinical and genomic data in order to help them look at holistic biomarker discovery. And in one of the recent pilots that we're doing with them as well, I think the numbers were several million documents in their NLP pipeline for a few 100,000 patients. With Roche, we have an application called HealthLink, including device data, which is their AccuCheck view, which is their connected blood glucose monitor. So we're integrating data from that patient-reported outcomes and activity data in order to look at preventive health strategies and personalized care delivery. And this is also exciting because you're looking at not only digital biomarkers, but also early disease warning signs. Then with Mercy on the operational side of the house, we've been able to use big data and analytics to look at real-time resource utilization, and we've delivered value for approximately 4.5 million in savings, dollars in savings. And last one is CancerLink, which is our big oncology data registry in the US, and this is part of the American Society of Clinical Oncology, and it's based on SAP HANA technology, and they've got more than 1 million patients there, and they've integrated data from 90 practices, and this was the example I was talking about, being able to connect different practices in order to look at the population health and ingest data on ECOG scores or TNF and look at patients like mine. So they're able to look at, in an anonymized fashion, at different cohorts similar to the kind of patients they are treating in clinical care. So real action and real impact in terms of better cancer care quality. And this is sort of where CancerLink is in terms of oncology precision medicine data landscape, and it's quite robust and it's still growing. And the ability to handle all that information and harmonize it is because of HANA sitting underneath that. We're also working on several projects in machine learning and different partner opportunities, either with chatbots and digital assistants to redefine patient interactions, with clinical decision support with our partners as well, and for healthcare professionals, and looking at NLP and using machine learning there to suggest patient translation. And from the ERP and the financial side of the house, automating and processes, more manual processes such as billing and invoicing in hospitals. This was a bit of an external perspective. And I found these 2 startups fairly fascinating, Q and Healthy.io, of how you're moving diagnostics out of the lab and into the at-home care diagnostics. And they're getting fairly sophisticated, and they give a lot of importance to design and customer experience, and it's quite delightful. I think both these companies are working with the regulatory agencies in order to get their devices certified and FDA approved, and this really brings us back to the point of how do you make it applicable to clinical care to really improve patient outcomes, early diagnosis and prevention. The last 2 examples simply just to illustrate the fact of how we've got smart lampposts. There's a project that we're working on which looks at smart lampposts and ability to track sensors on air quality and pollution control, and how you can feed that information back to get early warning signs and triggers for patients and health consumers, as well as increase safety and reduce risks. And ultimately also bring that machines to do predictive maintenance and reduce downtime. So this is a quote from our CEO, Bill McDermott, who says there's nothing that can make a difference in the world more than improving the outcomes of health in society. And therefore, SAP as a whole is quite dedicated to it. Thank you.